learned one big thing from that process. It's that we know people want a say. People are always clamoring about the fact that they don't get a say in things. We also know they're willing to serve, just like all of you here today. And that the problem in terms of developing programs for community engagement isn't that we ask too much of people, it's often that we ask too little. When we asked members of the Citizens Assembly why they were there, they said because it's real, because there's something on the table. It's not just talk for talk's sake.
How can governments evaluate how they engage citizens? And how can these processes be improved to bring citizens and governments closer together? This question is at the core of Engaging with Impact, an ambitious new Mass LBP project to identify the engagement practices that are most meaningful to citizens and suggest new ways for Ontario's local health integration networks, or LHINs, to enhance and track their progress. As part of the project's research program, 3 citizens' workshops on engagement and health were recently held in Kingston, Richmond Hill, and Thunder Bay. Citizens in each region were randomly invited to participate in the workshop. The first half of each day was dedicated to learning about the ins and outs of the healthcare system, as well as the challenges and complications the LHINs sometimes face when it comes to engaging with their communities. Experts from Queen's University and the University of Toronto helped everyone to better understand how the system works and were on hand to answer questions.
One of the problems is there's no such thing as the public. There's an enormous variability in terms of what the needs are of different sectors of the population.
What really holds those insurance schemes together is that they adhere more or less to the 5 famous principles of the Canada Health Act.
Senior executives from each of the LHINs did their best to explain how their organizations are working to transform Ontario's healthcare system, delivering better value and making it more responsive to patients.
The GTA in Ontario is really one of the most diverse places on earth, if you can believe it. This is the fabric of Central LHIN.
If you have a population less than 100,000 and you have a couple of catastrophic type of accidents even, that could actually bankrupt the system. So there's a certain number of people that you need to have to balance that risk.
With the learning phase complete, Mass LBP facilitators guided participants through 3 exercises: to establish a working definition of engagement, devise a series of metrics for evaluating the efficacy of future engagement exercises, and determine priorities for the efforts made by LHINs to engage their communities.
Is it available through print? Is it available via web, telephone, in person?
Send someone right here to the Food Assist Center. There's hockey mums, hockey dads sitting around here for hours watching their kids. Perfect way of engaging.
Because it's the ultimate responsibility. They allocate the money.
Each afternoon concluded with a plenary discussion where the participants were asked to rank and cluster the work of each group.
Which ones do you think probably belong close together? There are no right answers.
The final report includes a series of essays which address the task of evaluating engagement in both Canada and the UK. The report also details the process Mass LBP used and the recommendations suggested during each of the 3 workshops. A final section proposes a series of targets and indicators for evaluating engagement. Together, the 3 workshops highlighted the importance of creating a culture of engagement and learning that can help to drive transformation within Ontario's health system. First, it will require LHINs to do more to demonstrate that they value public input. Citizens expressed frustration that too often the purpose of an engagement exercise was unclear. They want the LHINs to focus on having clarity of purpose so that citizens can better understand what's at stake. They also want well-defined roles so that everyone understands who needs to be in the room and just how much influence they can have. In exchange for their investment, citizens want accountability, the outcomes and recommendations made during public meetings and consultations. Lastly, they want the LHINs to become more effective at communicating with their community. Specific recommendations and indicators for achieving each of these goals are explained in the accompanying report. Engaging with Impact: Targets and Indicators for Successful Community Engagement by Ontario's LHINs will be released in early February 2009.